The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and today we're going to be talking about women's health issues. One of the big killers for women is heart disease. In fact, it's the #1 killer. And our guest today, Dr. Eric Shadle, is going to be talking with us about heart disease as it relates to women's health. You see women all the time. You work in obstetrics and gynecology, isn't that right?
That's
have
right.
A rather large practice. I think you have 6 other folks that take call for you in your group. So you see a lot of women. And is it true the #1 cause of death is heart disease for women?
That's right. It is the #1 cause. More than all other causes combined, as a matter of fact.
And in your practice then, you know, you're talking about women's health and whatnot, you wouldn't really think about that. You think, well, that's not a women's issue. Do most women look at it that way? Do they think it's no big deal?
Actually, most women are more concerned with breast cancer and other issues than they are with cardiovascular disease. Somehow the message hasn't gotten out there that that is actually the public enemy #1 for both men and women, cardiovascular disease.
So what do you use in your practice? How is it that you educate people about heart disease and these issues?
Well, I'm glad you asked that because it really relates back to about 4 years ago when I went through a CHIP program that Dr. Deal, Hans Deal, is the founder of CHIP, which means Coronary Health Improvement Project. And I went through that program, and it, honestly, it changed my life. And it's a program that deals with lifestyle issues and dietary changes that can have a positive impact on a person's risk for cardiovascular disease, as well as a whole host of other medical conditions.
I think you have a graphic about this that kind of shows the general principles that go over.
Yes.
Now let's look at this.
Yeah, well, you see there CHIP, which is the Coronary Health Improvement Project. It's a 40-hour long lifestyle modification program. And there's 5 basic principles associated with the CHIP program. And these are the principles that have affected my life so positively. And that is, #1, we want to decrease empty calories, the empty calories that we would take in during the day. We want to decrease the amount of animal products. We want to eat more foods as grown. We need to exercise. And then a buddy system for accountability. A lifestyle change can often or almost always be very difficult to institute in our lives, and it's good to have someone that we can talk to and that can help hold us accountable.
So in your practice then, you not only are involved personally in this, but you involve people from your practice in it and refer people to it, and it works with your program.
Absolutely. I refer patients to a CHIP program. Actually, we do a CHIP program in our church. Local churches can do a CHIP program, and it's fun, it's easy to do, and it impacts people's lives dramatically.
Now it talks about a diet or a lifestyle change, but predominantly you're talking about the nutritional intake of people. What kind of changes are you asking them to make? What kind of diet is it?
Well, specifically, we're looking at decreasing the amount of fat we take in. In the United States, the amount of fat intake has actually gone down in the last few years, but it's still extremely high. It's about 37% of our total caloric intake, and the CHIP program recommends less than 20%. So that's the first step that makes a major impact. Another principle, when we talk about empty calories, most of our empty calories is because there's no fiber in the food that we eat. And the average American gets about 11, 12 grams of fiber a day. And that's average. That means there's a lot of Americans that get 1 or 2 grams of fiber a day. And that's just not enough for the body to be able to function normally. So the CHIP program recommends at least 30, and I personally recommend to my patients more than 40 grams of fiber a day.
And with women's health issues, this diet, what helps them with constipation, or?
Well, constipation, but you know, constipation, the same forces that are causing constipation also cause hemorrhoids, varicose veins that women are very concerned about. It causes diverticular disease that all people are concerned with, appendicitis. It causes, it can increase the risk for gallbladder disease, high blood pressure. Even a low fiber diet is associated with heart disease, coronary artery disease, and stroke.
So all of these basic fundamental problems you see then are addressed by concepts that are covered in the Coronary Health Improvement Project, or CHIP.
That's right. And just getting some more fiber and eating less fat in our diets.
Now I noticed that there's an exercise component to this program and all these other components. How does that work? You refer them, but what exactly do they recommend in this program, or what are you recommending to patients in terms of exercise and these other areas aside from diet?
Anyone who wants to lose weight, for example, should exercise 60 minutes a day in the form of walking. Now, if you are going to be a runner, or you're going to bike hard, or some of these other things, then you might be able to do less than that, such as maybe 30 minutes a day. But walking 60 minutes a day is a safe thing, and almost everyone can do that. And that is what we recommend, at least 5 to 6 days a week. But CHIP is much more than just diet and exercise. You know, to have health, we really need a balance between the physical, obviously, the mental aspects of life, but also the emotional and the spiritual. And if any one of those is out of sorts, then we're really not healthy. And so we need all 4 of those components coming together to provide for health.
So you don't just provide the social, emotional ties with all the people that are coming through your practice. You're able to refer them to a group of people that can give them that kind of support and also meet some of those other needs.
That's right, and that's why it's been so important in my practice to be able to do that. Because before CHIP, I was prescribing medications. For instance, menopausal symptoms, I would just get out the prescription pad and give estrogen, as opposed to talking about dietary changes and being able to put somebody into a program that can actually have an impact on their lives. As, let's face it, in a busy practice, I don't have time. Even if I took a half an hour or an hour with a patient, there's no way I can even start to impact their lives the way a 40-hour program that occurs over 30 days.
You know, I've heard about the CHIP program in different venues, talked with other guests here and different things, and talked with people who've done that. And they've seen some real changes in people's lives in terms of lowering their cardiovascular risk, heart disease, and you know, weight loss, and all those different types of things. But have you followed the people in your program and in your practice have gone through? What kind of documented changes have you seen in your patients?
I've seen in just 4 weeks, I've seen 20 to 25% drop in cholesterol in some of the groups that we've had go through the program. We see weight loss. Actually, we have an average of about a 4% weight loss. Now that's in 4 weeks. Now that may not sound like a lot, but 4% in 4 weeks is really pretty dramatic. We see a lowering of the pulse rate, which is a good thing, because the healthier we are, the lower our resting pulse will be. And we find blood pressures normalize. We've had a lot of people who've gone through the CHIP program actually get off high blood pressure medicine, get off of their Lipitor, which is a medicine to decrease cholesterol, and be able to get off of some of these things.
So that's not as hard on their liver. They're not having to have all these medications go through. And
that's right.
And so a lot of the things that you have to do, you don't have to do anymore.
That's right.
The medications. Okay. Now, are there any specific medical diagnoses in which CHIP is especially helpful in your practice, or I guess for everybody as well?
Well, I'll tell you what, I use CHIP principles in my practice every day. I see patients who have problems ranging from, like you mentioned before, constipation to menopausal symptoms, and I use CHIP principles for all of those issues. Weight is a big issue with a lot of women, men too, but of course I don't see men in my practice, so the women that I see are very concerned about weight, and the CHIP principles, that diet will definitely lend itself to decreasing weight.
So there are different groups. I think you have some graphics of different diagnoses that really are benefited in your practice that you shared with me. One was for postmenopausal people, and then others was for obstetrical. Let's look at the postmenopausal issues here.
Yes, we have here with the postmenopausal issues, I specifically use CHIP to talk to women about osteoporosis, heart disease, and vasomotor symptoms such as hot flashes. The CHIP program is definitely relevant in each one of those areas.
And so when they go to the CHIP program, they can really address in a fundamental dietary, nutritional, spiritual, motivational way osteoporosis. In other words, they teach them how to eat the green leafy vegetables and all those foods and how to prepare them so they taste good. And,
that's right.
And then heart disease, how that lowers their cholesterol, and then hot flashes. How does that work exactly with diet?
Well, with hot flashes, it's due to a rapid decrease in estrogen and maybe even an overall deficiency in estrogen. And what we find is that that effect is exaggerated by a high-fat diet, especially before the menopause, that will tend to increase the amount of estrogen produced in a woman's body, and thus when she goes through the menopause there's a bigger drop, and so her symptoms are much more dramatic.
So it sets them up to not be seeing that huge drop that makes them feel so terrible.
That's right. But once they are already menopausal and they make the dietary changes at that time, it may not help them get rid of hot flashes, but they will have mood changes that are positive, and they will feel better overall and be able to get through those hot flashes easier.
Mm-hmm. How do you use, well, the other thing was obstetrical issues. In other words,
yes.
You're an OB/GYN, so the OB things, what do you see here?
Well, I use CHIP for younger patients who are pregnant to talk about proper nutrition, calcium intake, and fetal health. Those are all, of course, issues that all pregnant women are very concerned about, and CHIP definitely has an impact in those issues.
So prenatal nutrition and all those different kinds of things. And is the diet or the nutrition that CHIP recommends, is it healthy for the pregnant mom?
Absolutely. It's in fact, it's the healthiest diet that any of us can eat. So there's nothing wrong with taking it in pregnancy. It's kind of interesting that I've had colleagues who are concerned about a woman on a vegetarian diet. In fact, I had a patient that that changed physicians, came to me, and on the front of her chart, and I think this might have been one reason she came to me, is because on the front of her chart, her previous physician had put on there that she was a high-risk pregnancy, and the only thing that made her a high-risk pregnancy was that she was consuming a vegetarian diet, and which in fact would make her a low-risk pregnancy, because the vegetarian diet will actually feed her baby better because you're getting more antioxidants, you're getting lower
plant protein.
That's right. You're getting plant protein. You're getting less overall protein, so you're going to have fewer problems with calcium deficiency and an overall calcium metabolism, because our high protein diets actually flush the calcium right out of our bodies.
I noticed here under obstetrical issues, that under that actually wasn't part of the postmenopausal or obstetrics. That you said that this seems to help people that are suffering from depression and fatigue, and also chronic pelvic pain and endometriosis. How does that work with the chronic pelvic pain and endometriosis?
Well, that's those are issues that that we have a graphic here showing that omega-3 fatty acids are increased when you consume a vegetarian diet, and it actually decreases the prostaglandins that cause pain, and it can independently seem to decrease endometriosis. Now let me just explain that a little bit, and that is that those omega-3 fatty acids that we are increasing through a vegetarian diet, through a plant-based diet, actually are the types of fatty acids that help to prevent pain. When we take an aspirin or an antiprostaglandin such as Motrin, ibuprofen, what we're doing is blocking the prostaglandin synthesis at a level that will prevent pain. And there are, in prostaglandin synthesis, there are two arms that goes down. One, prostaglandins that actually cause pain, the other one that actually reduces pain. And so we, in medicine, what we do is give patients medications to decrease pain by blocking the prostaglandins that cause pain. But if we eat plant products, we find a prominent production of the
blocking agents?
The blocking, well, the prostaglandins that don't cause pain.
Oh, okay.
And that actually relieve pain. And interestingly enough, if you eat a lot of animal protein, those products have the prostaglandins that go down the other chain that will actually increase pain.
So you set yourself up for what kind of pain you have.
That's right.
Chronic pain, or even, I don't know if it's related to acute pain, but certainly what you eat sets you up to either have more pain or less pain. Wow, that's fascinating.
That's right.
And so CHIP seems to be related to that, or is related to that.
It is related to that. And this has been documented in research that is certainly independent of any CHIP program or CHIP principles.
We're talking with Dr. Eric Shadle. We're talking about how he educates his patients in issues of women's health using the Coronary Health Improvement Project, the CHIP program. Join us when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We're talking with Dr. Eric Shadle. We're talking about women's health issues, and we're talking about the CHIP program, how you've used it in your practice to really minister a whole bunch of different problems and things that women deal with. Maybe have some other ways that you use the practice or the CHIP program in your practice. We want to talk about those, but we also, when we talk about that first, are there any other ways you use CHIP in your OB practice?
Well, obstetrically, I find that I use it quite a bit. My OB patients, those women who are pregnant, they're concerned about two primary things, I find, at least as it relates to their diet. One is that they're very concerned about weight gain, and they're concerned about calcium intake. And so I have the opportunity to talk to them about weight gain and some of the principles of how to eat as we've talked about earlier, the need to increase the fiber intake, the plant-based diet, get plenty of vegetables, grains, fruits, those types of things will help them, actually help them control their weight. But they're also very concerned about calcium, because it seems they all come in and say, my mother-in-law is making sure that I drink a gallon of milk a day or a half a gallon of milk a day, you know, make sure I get at least 3 or 4 glasses of milk. And many of them are extremely concerned with this, because many of them, they find that consuming milk is making them sick, or they just don't have a taste for it anymore.
Mm-hmm.
And
they don't want to drink it.
They don't want to drink it.
You have good news for them.
And I have good news for them, because actually for every glass of milk they drink, they have a net calcium loss, and that's been documented by multiple studies.
Mm-hmm.
And so for proper calcium metabolism, what they actually need is a good plant-based diet. And so they don't need any milk at all.
Wow, so that's a shocking news to them, that from all kinds of milk to no milk, and probably pretty gratifying, since I've told them, hey, drink a bunch of milk.
Yeah, actually what I do to tell them so it's not so dramatic for them, or such a dramatic change and seem radical to them, I really talk about protein and telling them that they really need to decrease their protein down to 50 grams a day or so. And that is one reason they don't need that milk.
So weight gain they are worried about. They're also worried about calcium intake. One of the things we talked about before the break was pain and prostaglandins. I guess prostaglandins are those things that lead to pain.
They're made in every part of the body. They're made in blood vessels. They're made in the uterus. They're made throughout the entire body. And they do a lot of different things. In some areas, they cause the blood vessels to constrict. In others, they cause the blood vessels to dilate. And that's because there's these 2 main pathways. And if you get those out of balance by eating the wrong diet, eating too much of or eating animal products, you get a concentration of the types of prostaglandins that will cause constriction, a type of prostaglandins that cause pain.
I see.
And so what you want is more of a plant-based diet that.
So before you have the baby and you're going to be experiencing a lot of pain from the childbirth, it would make good sense to eat foods that wouldn't stockpile all the things that would cause all the constriction and all the real violent pain, maybe.
That's right, yeah, that makes a big difference for women. And there are more and more ongoing studies that are looking at that, but I think over the next few years we'll see science documenting this more and more, yet one more reason to be on a vegetarian diet.
So a plant-based diet also probably helps them with constipation, which is big in pregnancy too, maybe.
That's right, because it's full of fiber. The only place you get fiber is in plant products, and so you eat your grains, and in fact, I give my patients a prescription. I give them a prescription. Those who are having problems with constipation, I say, well, you have a choice. You can either go to the store and you can buy your Metamucil and your stool softeners and that, which I can give you a prescription for, or let me give you this prescription. Eat a 7-grain cereal that has probably about 10 grams of fiber in it every morning. Put your bananas and put some strawberries in that, maybe a little bit of soy milk, and then eat 2 pieces of a good bread. In our area, we use a bread from a company that makes it whole grain breads, and there's 5 or 6 grams of fiber for every slice of bread, so a couple of slices there. I have my patients consuming 20 grams of fiber just for breakfast, and I don't know how many patients I've had come back to me and say, oh, thank you.
Things are on the move again.
Things are on the move. I feel better than I ever have before.
Are there any other areas that you use CHIP in your practice? You know, we talked about prenatally and all those different things. Are any other areas that you use those principles?
Well, one is in patients who've had surgery. So post-operatively, after the surgery, I talk to them about what I just said about the Metamucil, constipation, because abdominal surgery tends to cause the bowel to move very slowly. We call it ileus, and the bowel moves slowly. And so what you want is for the to have a proper diet to allow the bowel to move like it needs to. And so these same principles, looking at fiber in the diet, is very helpful for all postoperative patients, but in my case, women who are
had
of any
C-sections
age.
or
C-section or a hysterectomy or just about any type of surgery.
We have about 2.5 minutes, and I want to talk about something I think is very important. A lot of women that you see, they do have some bouts of depression, maybe postpartum or whatever depression.
Right.
And how does CHIP relate to that?
CHIP relates to depression by a couple of different ways. One is PMS, premenstrual syndrome. We see that very frequently. Of course, women can have depression in other areas as well, but we find that CHIP helps with depression by increasing the amount of omega-3 fatty acids, the tryptophan, exercise, proper sleep, and avoid negative thinking. Those are areas that actually Dr. Nedley has talked about in his book, Depression, The Way Out, which I found to be very helpful in dealing with patients and their depression.
You used a lot of big words, omega-3 fatty acids and then tryptophan. Are those related to elevating mood? Or?
Absolutely. It's really related to serotonin, which actually most of our antidepressant medications are used to increase the amount of serotonin that we have in our brain. And we find that actually we can increase that through natural means by eating foods that are high in tryptophan, for example, things such as tofu, pumpkin seeds, gluten flour, sesame seeds, almonds, black walnuts, black-eyed cowpeas. These are all very high in tryptophan.
And then that's made into serotonin, makes us feel better.
That's right.
So this diet actually helps get rid of the PMS.
Yes.
And also maybe any depression that comes after surgery or after having a baby.
That's right.
Fascinating. Proper sleep, negative thinking, all those different things, of course, go along with this whole thing.
Yeah, again, we're made to have the emotional and the spiritual and all these aspects of our lives coming together. And if one gets out of balance, then we're not healthy.
Thank you so much for sharing with us the way you integrate God's principles, really, in your practice concerning diet and nutrition. We hope you've enjoyed today's program and that you've learned things that can help you in your journey and that you have health that lasts for a lifetime as a result.